Hello, my name is Jara and today I'll be demonstrating a neonatal resuscitation. So first, I would like to prepare the area for delivery, and then second, I would like to do my hand hygiene technique, perform my hand hygiene, and put on my gloves. And then I would also like to prepare the area for ventilation and also check all the equipment in the room, just to make sure everything is working. So when I'm in the delivery room, there are a lot of situations that could arise, especially emergency situation. So in my case, I have a spontaneous delivery. There is no antenatal complications at birth, and after the midwife cut the cord, cut the cord, and the midwife noticed that the baby is has some concerns, so the midwife handed the baby to me. And upon handing the baby looks blue, the baby is not breathing, and it's floppy. So what am I gonna do? I will be assessing the baby's tone, the color, the breathing, and the heart rate. So after assessing, if the baby, if the neonate turned pink, it had a good cry, good tone, breathing, and also a heart rate of more than 100 beats per minute, you would like to do a newborn assessment or screening for this baby. But if you notice that there is an abnormal breathing for this baby, there's it's floppy, there's abnormal breathing, cyanotic, and the heart rate is less than 100 beats per minute, then first you would like to dry the baby. So get a blanket and then dry the baby, and then just keep the baby warm by covering it with the blanket. And then just check the airway of the baby, see if there's any fluids there. Get your suction, just suction that airway there, and then stimulate the baby. Just like hold their, just stroke their feet or their body, and just let them cry if possible, and then reassess this baby's color, breathing, tone, and then heart rate again. If this baby is still cyanotic, and then it's still floppy, it has no breathing, and the heart rate is less than 100 and the heart rate is less than 100 beats per minute, you would like to assess again. So if the patient turned pink, and then it had a good cry, and then it had a good tone, it is breathing, and the heart rate is returned to 100 beats, more than 100 beats per minute, you would like to hand this to the return the baby to the mother, and then just let them do a skin-to-skin contact, so the baby could be warm, and then just have the mother initiate breastfeeding for this baby. And then if the baby is still cyanotic, it's not it's still floppy, it's not breathing, and the heart rate is less than 100 beats per minute, you would like to initiate 5 inflation breaths. So before doing that, you would like to position the baby in a neutral position, and then just get an appropriate size mask for the baby. Just make sure that it's covering the mouth and the nose, and then just hold the mask in a C and E technique, which is C, like the thumb and the index finger holds the mask, and then 3 of your fingers hold the mandible of the baby. So you would like to make sure that it is stable, and then just give some breaths, just squeeze the bag of this squeeze the bag very gently, and then just do just give the baby some breaths for every 2 to 3 seconds. So do this for 5 times. So just make sure that you count loudly, that way you know the rhythm of the breaths. So 1 1 2 3, 2 1 2 3, 3 1 2 3, 4 1 2 3, 5 1 2 3. So you already gave 5 inhalation breaths. And then So after that, if the baby is still not responding, it's still cyanotic, it's still floppy, there's no breathing, but you also did not note any chest movement, you would like to position the patient again and then repeat the maneuver. So give the baby some 5 inflation breaths again. And then after that, you want to reassess the baby's color, tone, heartbeat, heart rate, and breathing. And if the neonate returned to pink color, it's beginning to cry, has good tone, it's breathing again, and heart rate is more than 100, you would like to return the baby to the mother and then do a skin-to-skin contact again. And then just make sure that you also breastfeed the baby, and then just closely monitor the mother and the baby every every now and then. So after that, if your baby is still pink, if your baby is still pale, it's still cyanotic, still floppy, no breathing, and then the heartbeat is very low, less than 100, but then you can see a chest movement. So you would like to initiate a 30-second ventilation breaths. So what you do is just get your mask, and then use jaw thrust, which is just put your fingers on your foot, put your 2 hands on the neonate's jaw, and then just put the jaw forward a little bit. That way you could dislodge the tongue and provide more airway to the neonate. And then usually it is done between 2 people. Just let another staff member hold the mask for you. Just make sure to cover the nose and the mouth, and just squeeze the bag every second or 2. So do this for 30 seconds. So 1, 2, 3, 4, 5, 6. So do that until 30 seconds. Just make sure that one person is holding the jaw and doing the jaw thrust. And then just reassess again the color, the tone, the breathing, the heart rate of this baby. If the baby is breathing normally, just provide post-resuscitation care after this. But if the baby is still cyanotic, you notice that it's not really responding, and then the baby still has no breaths, it has it is floppy, low heart rate, and then there is some chest movement, and then help is arrived, you would like to so there's no progress with this neonate, you would like to start compressions for this neonate. So to start compression, you would like to hold the neonate's chest using your 2 hands, and your thumbs should position on the lower third of the sternum. Usually it is just below the nipples, so you would like to position that, and then just make sure that when you're compressing, you're putting enough depth, like 1/3 of the chest is depressed, and it's about 1.5 depth of in inches. So just provide 3 compressions and then 1 breath for this patient. So when you're doing your compression, just make sure that you let the chest recoil after doing another one. So 1, 2, 3, and then have another person do the breath for you. So just squeeze the bag, just get some 1 breath, and then just make sure just check the patient every 30 seconds. Just check the heart rate of the patient, see if the chest is responding, if there's any chest movement, if the baby is starting to breathe after every intervention that you do. If not, if the baby is still floppy, but then the color is getting slightly pink, the heart rate is becoming normal, but there's still irregular breathing, you would like to continue giving the neonate ventilation breaths for 30 seconds. So do the ventilation breaths again for 30 seconds. So 1, 2, 3, 4, 5 until you reach 30. And then after that, you would like to assess the patient, reassess the patient. If it's returning to pinkish color, and then the heartbeat is becoming stronger, and then, you know, the baby's breathing again, but it's still floppy, you would like to just stop the resuscitation at this point, because the baby is going to start to get back to its normal state. And then but if the baby is still not responding after 30 seconds of doing all the you know, ventilation breaths and all that, you would like to do uh, just you know, assess again and see if the heart rate, is less than 30, less than 60 beats per minute. And then you would like to, if the baby is still not responding with anything that you do, the heart rate is less than 60, you would like to administer epinephrine for this baby, along with the continuous positive pressure ventilation. So usually that's a machine induced ventilation. Just hook it up and then just continue doing the chest compression every 3 to 5 minutes. So do the chest compression every 3 to 5 minutes. And then if after 10 minutes you've been doing all your efforts and you don't see any response from this baby, then you would just you know, do your own judgment and discontinue your resuscitation. Sometimes after 10 minutes of doing all your efforts, the baby may not respond anymore, and you know, based on your judgment and the doctor's judgment, you would see how the baby will respond, or if the baby will still respond. So after doing all of this, of course, you would take off your gloves and discard it to the proper receptacle and perform your hand hygiene technique. So hope you will learn from my demonstration, and have a good day. Thank you.